Hills and mountains, long distances. For years, these landscapes slowed emergency hospitals' responses and cost lives. Getting blood and essential medicines to remote hospitals was a race against time. About 10 years ago, everything changed. Today, saving a life can start with just one click of a green button. Within minutes, a Zipline drone is in the sky, delivering blood and a life-saving medicine to hospitals across Rwanda. At the heart of the operation is the Zipline call center, operating 24 hours a day, 7 days a week. Hospitals places requests through phone calls, SMS, or WhatsApp, asking for blood or urgent medical supplies. The moment a request is received, the control team acts immediately. They coordinate the storage team, prepare the medical package, and hand it over to drone operators. As some drones return from deliveries, others are already prepared for takeoff, creating a continuous life-saving cycle in the sky. On average, about 800 medical requests are received and delivered every single day, reaching hospitals faster than traditional road transport ever could. Each flight means hope, each delivery means time saved, and often a life preserved. Pierre Kaitana, Zipline Rwanda's country manager, takes us through a journey of a decade.
Thank you. Welcome to Zipline. My name's Pierre Kaitana. I'm currently country director for Zipline in Rwanda. We are in Muhanga today. It's the middle of Rwanda where we are at Zipline. It started here a decade ago, 10 years ago, precisely towards the end of the year in 2016. So we should be celebrating our 10th anniversary in few months to come. But a lot has been achieved. In a partnership with Rwanda government, Zipline was born. We were born in 2016, primarily establishing the very first Zipline hub for distribution of medical products, healthcare logistics, for blood initially. Emergency saving lives by delivering blood to transfusion facilities that are located outside Kigali. Back then in 2016, two things. Muhanga, which was formerly known as Gitarama in the past, was not a well-known place. There's a long history with that, with what it is. So we started in 2016 in Muhanga with our very first distribution center for Zipline in the world, right here. But today we also have another center, distribution center, the second one that came up in 2019 in Kayonza district. With those two, we're able to serve the north, part of the west, south, and east, which is served by Kayonza. Here where we are in Muhanga district this region was formerly known as Gitarama in the past. It was not really a famous place in Rwanda, although it's the middle of Rwanda. It has a long history with that. But when you look at what Muhanga was in 2016 when we started here, there was no major infrastructure like factories, the innovation hub like Zipline, major hospitals, but today there's a complete transformation. Not only the Kabgayi Hospital in an innovation hub like Zipline, we have almost 5 other factories that are in the industrial park of Muhanga. So it's an area that is growing fast with its proximity to Kigali and being in the center. So Muhanga is becoming a significant place, and we are happy to be part of the story of this place. What we do At Zipline, as I told you, in 2016, we started by being contracted to deliver blood on an emergency basis to save lives. We started with Kabgayi Hospital. Back then, it was 1 flight per day, 2 flights, 3. Then one day there was 20 orders. It was a big celebration by the team. But today we have stopped celebrating. We do hundreds and hundreds of flights on a daily basis. We are looking at every 50 seconds, we have a request and we have a flight. So it's quite busy. So we employ a couple of hundred people in Rwanda who work at Zipline. 50% of them are from medical and health science background. They could be nurses, pharmacists, lab technicians, vets, biotechnologists, and so on. So they understand the orders that we receive from facilities. They know how to pack, they know about the dosage, and so they run one of the biggest pharmacies in Rwanda is based here at Zipline. The remaining part of the team, they are from technical background, different levels, up to also engineering, any type of engineering. So when they all come here, both from health sciences and from engineering background, they are trained at Zipline for a month. We have the Zipline Academy, where we train any Zipliner who gets a job at Zipline to master some of the system. Why do we do a 1 month program? It's because Zipline is an end-to-end company. We build the drones ourselves, we maintain ourselves, we build our own softwares to the maximum. And this is innovation. And it's first time we do things that have never existed in the past in history. So therefore, you cannot go in a shop and buy a piece of a component, because we build the drones that's made for a specific purpose, and it's the first time that it is done in the world. So that's why you see us having a lot of proprietary software and hardware to be able to do medical logistics, healthcare logistics in Rwanda. And from Rwanda, we have expanded. We're in 5 countries in Africa. We're in Europe, we're in Asia, we're in the United States, and there are big plans ahead. The way the whole system works, just to explain the entire process, is that today in Rwanda, any health facility facing a challenge or needing a tool or a medicine, they can use any digital means to place an order to our call center. You can send a WhatsApp message, you can send an SMS, you can send an email, you can place a phone call. You have trained healthcare specialists running the call center. They will be able to interpret your order in any language, and they can be able to propose to you alternative in case you're asking for a certain product and there's another variant that is available, so they can be able to support you and create an order. Once the order is created, it has an order ID, so it goes to our warehouse, which is a pharmacy. It's actually a level 3 medical grade pharmacy, which is the highest standard of a medical warehouse. We are allowed to store blood, vaccine, cold chain product like insulin, oxytocin, over 300 types of medical product, medicine. We have anything that you may need in a surgical room, emergency room, surgical gown, gloves, name them. We have vaccine, both for human. We are very involved in immunization in Rwanda. We have brought in a lot of innovation into the immunization process of Rwanda. We do the routine vaccination for children. You might be knowing rougeole, polio, penta, OPV, and all the types of routine vaccination that babies 0 to 15 months should have as a must, as part of the immunization program of Rwanda and recommended by WHO. So we help the government of Rwanda, RBC, EPI, to drive immunization and decentralize it further within the communities. So we bring vaccine much closer to where people live and work from, and moms don't have to carry the heavy babies, 15 months babies, all the way to the health centers and hospitals. So today, with the support of Zipline, even in places where there is no fridge or cold chain equipment at the health post, they're able to vaccinate. So we are also becoming very strong and building a lot of expertise in animal health. You must have recently listened to the conversation during the national dialogue known as Umushyikirano. They were talking about, one of the participants was talking about a challenge with azote. Basically, it meant that there is a lack of liquid nitrogen tanks to be able to conserve artificial insemination product for pigs and bovine, cows, cattle artificial insemination. So what Zipline come with a response is that it is actually defying the need to always have a fridge or cold chain equipment to be able to perform vaccination, immunization, and carry artificial insemination processes which require heavy cold chain system. With Zipline, because the drones can reach very fast to any point in Rwanda, so we are now able to pack the commodity. When someone has placed an order, it takes us 1 to 2 minutes to pack the product and fly it immediately to the location, and it's already injected into the animal or into the human. So it's completely revolutionized both human health but also strong intervention in terms of animal health. We can reach to any point in Rwanda in minutes because we don't follow a road network. So we see sometimes there are trucks on the way, ambulances are struggling with traffic jams or trucks blocking the narrow roads. So even when there are no roads, drones can reach. So that's how we have revolutionized the health system of Rwanda, and we have kept the way the health system is organized. Nothing has changed. It's the community health workers, health post, health center, referral hospital, district hospital. The pyramid has remained the same, but the amount of technology that has been introduced has made the health system of Rwanda resilient, super sophisticated, by the principle of centralizing what you saw in our warehouse as medicine. We are able to also ensure that we don't have an hospital with an overstock and a neighbor hospital with a stock out. So we centralize commodities, and it's only on demand that we receive an order and fulfill the order. So it has avoided wastage, expiries, overstock, and stock out. Rwanda, in the years of 2014, 2015, the country had a bold agenda and had made a decision that ICT should be a pillar of the development of Rwanda. It was actually well marked already back in the years of 2000 when the Vision 2020 broad policies were being developed. In 2016, when Zipline started, Rwanda didn't have a drone regulation. But because of the appetite of innovation to be able to take care of the population and the appetite for bringing more technologies into the country and more investment, Zipline was welcomed and well accommodated. And the philosophy was that even if there are no drone regulation, let's not reject innovation, but we can study together and build it together. The Minister of Health at the time thought this drone technology would be mostly appropriate for blood delivery. But as you can see today, after a decade, we have learned a lot together in strengthening the health system of Rwanda and make it more responsive and more resilient. There are hundreds of medicine that could be rare in the world, that can be expensive, that can have a short shelf life. So there are more and more reason to centralize more medicine with Zipline because it's the most appropriate for the service. And beside that, we've also talked about immunization, the way we decentralize immunization. All that has contributed to the fact that it used to be one flight per day, and now you are flying hundreds of drones in all directions. And people who have used the service have enjoyed the reliability and the responsiveness and the availability of the service 24/7. So the demand is only growing every day. This is the third generation of drone, the aircraft itself, because we have also learned a lot about the terrain of Rwanda, the climate, the geography, and we are seeing more and more less incident in the community. So in the past, with the initial drones, they had a lot of mechanical issues, but not anymore. We defied the rain, we defied the night. We also able to navigate wind, stronger winds, precision to deliver at the right place. So we have really improved our technology over the years, and we plan to continue to do so. So our drones are powered by batteries, lithium batteries. So we charge them here. The battery can last over 3 hours. It means from Muhanga we can go to Rubavu in the north. We can go to Rusizi in Mibirizi. Those are very far places. Just to give you a picture in context, if you were to take off by car, like the way you came from Kigali, it would take you approximately 7.5 hours to reach Mibirizi. And the terrain sometimes is difficult with the rain, but Mibirizi hosts one of the most well-equipped hospitals in Rwanda, because it serves not only Rwandans but also the regions across. With a drone, it's a matter of minutes. So that's the benefit. So imagine leaving Muhanga to Butaro in less than 25 minutes. And by car, these are hours, 3, 4, 5 hours on the way. So that's how fast the drones are. So they fly at a speed of 103 kilometers per hour, but because they don't follow the road network, so it's an eagle view. So you go straight to the location without transiting through other towns. So it has a big advantage in terms of saving lives. 2026 is a big beginning for us at Zipline. We recently signed with Zipline International, signed a partnership with the United States government through the State Department. The idea was we received $150 million. We are very grateful for the support from the United States administration. This $150 million was designed with a purpose to say, why don't we make sure that in the 5 countries where we're already operating in Africa, we do not duplicate other logistics. We make sure that wherever there's Zipline in a country, either it's in Cote d'Ivoire or in Nigeria or in Kenya or in Rwanda, where we are, we make sure that we are covering with drone technology in healthcare nationwide, full coverage. When we looked at 10 years of existence in Rwanda, what we realized is that it was unfortunate to see that some facilities and of course people in the western province of Rwanda had not yet received this service because of the distance. From Muhanga to Rusizi or Nyamasheke, you fly over the Nyungwe forest. When you try to avoid flying over the national parks, you go all the way around, and the distance becomes so long, it required to build another piece of infrastructure in Rwanda, in the western province, that can make sure that we now fully and confidently, safely cover Rwanda 100%. So we are going to build, from that fund we receive, we are going to build a 3rd hub in Rwanda. It's going to be located in the beautiful Karongi city by the lake. So from there, we will have the ability as Zipline to cover another set of 60 new facilities that had never received Zipline service in the past. Places like Nhombo, Bugarama, the entire facilities in the Rusizi district, Nyamasheke, 100% of it. And now with Karongi, Muhanga, and Kayonza, Zipline will be now confidently saying that we are covering 100% of facilities located in Rwanda. The $150 million is not only for Zipline in Rwanda, but it's to expand in the African countries where we already exist and make sure that we cover the countries entirely. In Nigeria is a big country, very big population. It has 36, 37 states. So we are so far in 3 states, Cross River, Bayelsa, and Kaduna. So the idea is now to say, how do we go to Zaria, how do we go to Akwa Ibom, how do we go to XYZ places in the country and make sure that we cover 100%. So that's the deal that we have signed with the United States government. Rwanda again, just like in 2016, was first in line to sign a renewed partnership with Zipline that extend our contract, of course, but ensure that we do 3 things. We build Karongi Hub, we bring drone technology to the city of Kigali. It can do healthcare deliveries for hospitals in Kigali, but also commercial deliveries, food deliveries, for those who enjoy receiving a pizza or a coffee or vegetarian burger at the house. So the drones are coming in around 2027. And the last thing that we're going to do is the support that we have received as part of the renewed partnership with the government of Rwanda is to also relocate one of our global testing sites. A global testing site means if we identify a good location in Rwanda, mostly the northern part of Rwanda where you can find extremes, a lot of lightning, high altitude, mountainous area, a lake, border nearing the area, some difficult condition where we should position our global testing site and be able to build, manufacture new drones, test them in the most extreme condition, and be confident that we have enough data to export these drones in any new country where we will expand Zipline. It's been a lot of learning. We are on the 3rd generation of our aircraft itself. It shows you that we have had to iterate the process, build new parts, understand new challenges in terms of weather, geography, climate, night, wind, rain, and those conditions have really trained our staff. We have gained a lot of experience and we have understood our business better. On the other hand, in terms of software, we have been able to also improve various versions of upgrade of our software. We're in 40th version of the software to improve on safety, reliability, and so on. But in real terms, beside us mastering our technology and our processes here in terms of safety and technology improvement, we're talking about the people. Our biggest challenge was to be able to serve people on time. We have understood the healthcare system of Rwanda. We have entered in partnership with the government of Rwanda, Ministry of Health, Rwanda Biomedical Center, Rwanda API, the Blood Division Transfusion, the National Children Development Agency, and the Agri-Tech, Rwanda Agriculture Board. So we've been talking to vets, doctors, nurses, government leadership to start understanding more how can Zipline contribute to eradicate certain disease, to intervene during pandemic, to prevent outbreaks, and to increase the opportunity for the doctor to treat more patients. So it's been a journey together, but it's a lot of learning for us as well.
From challenging terrains to cutting-edge technology, Zipline has transformed healthcare delivery in Rwanda, proving that sometimes the fastest road to saving lives is through the sky.